Good afternoon, Governor.
Good afternoon.
First question is, how did the first day of door-to-door notifications to out-of-staters in our coastal communities go?
So today is the first day. We've only been doing it for a few hours, but by all accounts, it's been going very well. I think having a physical presence in these communities is very important. It shows how serious this is. Yesterday, I had a call with the town managers, mayors, and chiefs of police in all of the coastal towns. They're terrific. They're collaborating with us. I'd like to say thank you. I also want to remind everyone at this point, I've called up 1,000 guardsmen and women, and they're fantastic. They're working around the clock. And so thank you to General Callahan, and thank you to everyone in the Guard who's stepping up.
This next question is for Dr. Alexander Scott. ProPublica reports that other states have plans to triage life-saving medical care, if necessary, so as to disfavor patients with cognitive disabilities such as Down syndrome or Alzheimer's disease. What is the policy in Rhode Island? Will hospitals and doctors have discretion to use such criteria?
Our policy is to do what the governor described earlier. We want to make sure that the community mitigation strategies we are saying are followed so that our healthcare system has the ability to respond to those in need. We do not have a plan right now to discriminate against or disfavor any patients from any particular standpoint. We want to make sure that our healthcare system has the capacity they need to care for those who have the most serious illness. The key to us getting there is all of the steps that we are talking about now. Every member of the community, 100% of Rhode Island's population, needs to be able to follow the recommendations that are given. We need the community parties, the access to stores where there are crowds. We need those activities to stop. That has a direct connection to our healthcare system's ability to be able to care for all of the patients that we want them to care for.
Governor, the next question is, do you have any immediate plans to hire more bilingual customer service reps or move state employees around to increase capacity at DLT?
We do. Every day we are striving to get a little bit better at providing information to all Rhode Islanders. Just so everyone's aware, these press conferences are all translated into Spanish. Every day on social media, on Facebook, we put out all of the key announcements in Spanish. I have my Spanish-speaking staff every day on Spanish-speaking radio. So if I'm offering that so folks know exactly where they can go. And of course, the information on the COVID website is in Spanish. Having said that, what I would say is DLT, Department of Labor and Training, is stretched to the limits, literally like never before. The number of claims we are receiving on a daily basis today exceeds what we received on a weekly basis during the peak of the 2009 recession. The very best advice I can give you is to please not call the Department of Labor and Training. Please operate exclusively through the website. Every time that someone calls and checks in on the status of their check, that just diverts that person's attention at DLT to answering the call instead of processing the check. So we are, throughout state government, we are looking to deploy resources to have more Spanish speakers. Having said that, please do not go into the office at DLT. Try hard to resist the urge to call. It's probably going to take us 10 days to get you your check. We'll do everything we can to get it to you more quickly. And all applications for TDI or UI should be filed on the website. If you don't have a computer, and if you're not able to do that, then of course pick up the phone and call to file your claim.
What does the stay-at-home order mean for restaurants offering delivery and takeout? Can Rhode Islanders still go and pick up their food?
We want the stay-at-home order to really reflect the goal overall that people stay inside, except for those essential needs. We want to really advance food delivery service options so that if you can call and have it delivered, then you can do that. If people absolutely need to go pick up their food, they can do that, avoiding crowds and any large gatherings of people to do so.
All right, the next question is about testing. Do you still plan on having drive-up testing sites as originally announced? Without testing, we have no way of knowing what the real numbers are, and our testing numbers are so low. What is the reason we are so far behind?
We do have the drive-up testing sites and can build that capacity out as quickly as we need to. Similar to what the governor has shared, the challenge has been making sure that we have the supply chain in place for our laboratory needs to be able to expand the testing the way we want to. We are still taking it in a stepwise pattern. We are working directly towards the governor's goal of getting us to 1,000 tests, but the challenge that we have faced, as well as others, across the country has been having the laboratory supplies needed to exponentially expand it the way we want to, and we're doing important work to address that so that our process can be sustained for the long term.
I'd like to address the testing question to give people a sense of where we are and where we're going. I don't think we are very behind, and certainly if you look at other states, we are not very behind. We are not where we need to be or want to be. The goal that I've set of 1,000 tests per day, which I hope to be able to achieve by next Thursday, would put us in line with the level of testing that you see in countries such as South Korea when they really started to get a handle on the crisis. The reason we can't get there sooner is because we are in a ferocious fight with every other state and many other countries for the medical supplies that enable the testing. I have tried many analogies to explain why this is so difficult. There's no one ingredient, there's no one supply to make this testing work. You need all at the same time the requisite number of swabs, testing kits, vials to transport the test, the actual machinery, sometimes more than one piece of machinery, the reagent, which is specific to each machine, and every one of those supplies is in short supply all around the globe. So the other day I used the example of making a cake or your favorite recipe. If you're baking a cake, you might have the eggs you need, but if you can't get the butter you need, you cannot make the cake. It's a very simple analogy, but that's what we're dealing with. So every day is a fight in the global market to get the supplies we need. Every day we're making progress, and today I still feel confident that by late next week we'll be at 1,000 a day. It's going to be incredibly important at that time that we triage who gets the test first and how rapidly the test results are delivered. So we are in the process now of putting together a statewide testing system. High-risk people will get their test in one place. Same thing with frontline healthcare workers. Same thing with folks who are very sick. They're going to get their test back much more rapidly. And then everybody else, we're trying to set up a system so you have access to the test at no charge to you. But some folks are still going to be waiting a day or 2 or 3 to get the results because we're going to have to rely on labs that are out of state. Early next week, I will have an announcement explaining that in great detail, but I think, my mantra through all of this has been to be absolutely transparent with the people of Rhode Island, and that's as honest as I can be about where we are now and where I want to go. The metric we have our eye on right now, every minute of every day, is the number of people in the hospital. So the person who asked the question is exactly right. We don't know exactly how many people have it. We're telling you today 239 have tested positive. There are absolutely many more people in Rhode Island who are COVID positive that we haven't had a chance to test or get the numbers back yet, which is why we are so serious about ordering you into quarantine if you have symptoms. So the name of the game now is, if you're sick in any way, don't leave your house. Unless, of course, you're very sick, call your doctor, go to the ER, and do what your professional healthcare provider says. And we're watching hospitalizations, because that's a fact, that's knowable. And we have our eye on that to try to tell us where we are in the curve and when we might be seeing a surge. There's a lot of information, but again, I think it's important that everybody knows what we know, so you have a sense of confidence around what's happening. Overall, as I look at where we are in the crisis, having been fighting it for 4 weeks, only 2 deaths, 29 people in the hospital, the system getting a bit more ready every day, I just have to say thank you to all the hard work that's happening, because we are in much, much better shape than many other cities and states around the country.
Governor, please state clearly whether this general shutdown applies to food sources, restaurants, grocery stores, coffee shops.
It does not. As I said, well, restaurants are already shut down. So restaurants, coffee shops, cafes, I was crystal clear about that yesterday. They are closed for all dine-in service until April 13th. So no bars, no restaurants, no cafes, coffee shops for dine-in. That is closed. You are still able to do takeout, and I have made it so that you can do beer and wine takeout with your food. Delivery is still allowed. Grocery stores will not be affected. Food stores will not be affected. They are still open. You are still allowed to leave your home. As I said earlier, you can leave your home to get essentials, gas, food, medical supplies, essential things. Leave your house, do what you need to do, limit your exposure, go home. So no, none of those food or food-related retail shops are affected by this order. Remember, I have imposed regulations around social distancing for grocery stores and big box retailers. They are limited in the number of people that they are allowed to have in the store at any one time. We have people at the front door with a clicker to count the number of people. And when if you're in the store and you're in line, if you're at the deli counter and you're very close to the next person, you're doing something wrong. Move away. If you're in line at the cashier and you're very close to the next person, please step away. So I hope that that is clearer.
This next reporter is asking you to repeat some of your earlier remarks in detail about the quarantine orders for those who work in neighboring states like Massachusetts and Connecticut. Does this mean people who work in Massachusetts can't go to work?
No, what it means is if you work in Massachusetts and you can work from home, you must work from home. So call your boss and ask if you can work from home. If you're allowed to work from home, you must work from home. There are many people who can't work from home. If you're a nurse, if you're a doctor, if you're a construction worker, many other things, I know that's not possible. So what I'm saying to you is, you're allowed to go to Massachusetts to do your job. Go to Massachusetts, do your job, come home to Rhode Island, and stay in your house. The other day, Governor Baker said he wants everyone coming to Massachusetts from another state to self-quarantine. So I'm in touch with Governor Baker and Governor Lamont on a regular basis, and we're trying to the extent possible to coordinate our messages. Again, it's consistent to what Dr. Nicole Alexander Scott said. I need you to follow these directions, but also to use good judgment. The goal here is to keep everyone safe, for you to limit your contacts as much as possible. Absolutely, if you're sick in any way, you must stay at home. But also, I want you to keep earning a living if it's at all possible. I want as many businesses to be able to work as long as possible. So if you have to work in Massachusetts, do it. But when you come home at night, I need you to stay in your house. And if you need a hand getting groceries or living your life, then reach out to us, And we're going to be really, as we have more and more people in quarantine, we're really going to be ramping up our services to help you get you what you need while you're in your house.
Governor, the next question is, what happened with the tour of Rhode Island facilities by the Army Corps of Engineers? With other states building overflow hospital units, why isn't Rhode Island doing this aggressively now?
That is exactly what we are doing. We have a team of Army Corps of Engineers here on the ground with us. They've been here for about a week. They're working in close collaboration with the National Guard, and we have spent much of the last week surveying every possible place in Rhode Island that could be turned into a hospital. Yesterday, I personally was on a phone call with all of the hospital CEOs in Rhode Island, asking them to make sure that they have their surge plans in place, and we're working very collaboratively with them to figure out where the best places are in order for us to ramp up hospital capacity. I would like to thank all of the hospitals, and I mean all of them, from top to bottom, from the CEO to the custodians and CNAs and nurses and doctors and therapists and social workers. God bless every one of you. Thank you for your collaboration, and thank you for working so hard. I wish I could say this was going to get better. It's going to get worse before it gets better, so thank you for your strength. But for the people of Rhode Island, that's exactly what we're doing. We have a surge plan, and we're trying to work the plan. More hospital beds, thousands of hospital beds. We want to be able to provide thousands of additional hospital beds, staff those beds at the bedside, extra ventilators, extra PPE, extra medical equipment. That's exactly why I need your cooperation, because I cannot flip a switch and say 2,000 extra hospital beds. We need a few more weeks to get the system ready.
What happens if New Yorkers do not comply with the self-quarantine?
I made a decision yesterday that the quarantine for New Yorkers is not a suggestion, it's a direct order. It is punishable with penalties, in the first instance a fine, but also imprisonment. That is not our goal, that is not what we're trying to do, but I want to be crystal clear about this. If you're coming to Rhode Island from New York, you are ordered into quarantine. The reason for that is because more than half of the cases of coronavirus in America are in New York. And it is getting worse, not better. We are less than 200 miles and a few-hour drive from New York, so this is not meant to be discriminatory or unfair. It is a fact, and consistent with our approach of being targeted and aggressive and fact-based, I felt that this was a necessary thing to do.
To continue that thought, New York City Police will be issuing fines to people disobeying social distancing rules. Will police in Rhode Island be doing that too? And if so, starting when and which police forces?
The answer is yes, and the answer is they already have. And it's all police forces. The Rhode Island State Police is out in force, as are local police departments, and it's just for all of our own safety. So that has already started to happen.
Next question is about our furry friends. Are pet stores for food essentials considered essential retailers?
Yes, they are.
That was easy enough.
He's usually not that brief.
And our last question for today's briefing, are the state police now going to be stopping all people with non-Rhode Island plates, even Massachusetts? What about people in East Providence or Seekonk who grocery shop right over the border?
That's an excellent question. The answer is no. So, as I said in my opening remarks, I have no perfect solutions here. Every decision I'm making is difficult and far from perfect. So the enforcement of this quarantine, as between people driving between Massachusetts and Rhode Island, is incredibly difficult, if not impossible, to enforce. So I'm asking the people of Rhode Island to obey and do the right thing and pitch in and do what's right for yourselves and your community. We will not be pulling over cars that have Massachusetts license plates, and we will not be stopping Rhode Island cars coming back into East Providence from Seekonk. We're doing that for New York only for the reasons I've already described. So what I will say to you is, just do the right thing because it's the right thing to do. If you live in East Providence and you go to Seacon for your groceries, fine, go. Go there, limited in time, go once a week, don't spend too much time, keep your social distance, not a problem. Come home, wash your hands, don't go if you're sick. But there will be no enforcement with license plates for people from other states other than New York.
Thank you very much, Governor.
Thank you. See you tomorrow.